Hi everyone. So we are going to talk about Durkan'S Test.
Before that, let me tell you a story. So here, this person worked as a barista in a coffee shop. One day, she felt like she can barely hold the cup anymore as she always felt numb on her hand. This may be due to the repetition use of her hand, so she decided to see the doctor. The doctor suspected as carpal tunnel syndrome.
Do you know what CTS is?
Carpal tunnel syndrome is caused by the pressure on the median nerve. The symptoms may include tingling or numbness, usually on your thumb, index, middle, and ring finger, and weakness. For the risk factor includes anatomic factors of your hand, gender, usually more common in women, inflammatory condition, medication, obesity, and workplace factors. For carpal tunnel syndrome, there are several tests that can be done in diagnosing, which includes nerve conduction study, electromyogram, two-point discrimination test, renal test, Fallon test, and Durkan'S test. Okay, so now let's look further into the Durkan'S test. So for the description, Durkan'S test was proposed by John A. Durkan in 1991. It is also called as carpal compression test. The application consists of direct pressure on the carpal tunnel and the underlying median nerve for as long as 30 seconds. For the purpose, the Durkan'S test or carpal compression test serves as diagnostic test for carpal tunnel syndrome. Okay, next is the procedure for Durkan'S test. First, applying direct compression on the median nerve. Second, moderate compression is applied with both palms. Third, the compression is given for as long as 30 seconds. Fourth, the test is considered positive with the presence of numbness, pain, or paresthesia.
Okay, so now I am going to demonstrate how to do the Durkan'S test, or also called as carpal compression test. So first, the patient's forearm is supinated and placed on the table, and then the examiner will compress the carpal tunnel for 30 seconds. And then if the patient felt paresthesia, pain or numbness alongside the median nerve innervation, which is the thumb, index finger, middle fingers, and half of the ring finger, the test is considered positive.
Okay, next, let's go to the evidence. In 1991, Durkan reported that the carpal compression test was 87% sensitive and 90% specific, whilst in 1997, Gonzalez reported that the carpal compression test achieved a sensitivity of 87% and specificity of 95%. A study in 1994 reported that Durkan'S test has 89% sensitivity, whilst in 2004, from a systematic review study, Durkan'S test reported a sensitivity of 64% and specificity of 83%, whilst in 2019, a study reported that the highest sensitivity was seen from Durkan'S test, which is 95.6%. Based on one of the latest studies in 2020, it is said that Durkan'S test has the highest sensitivity and the lowest specificity in between the renal and Fallon's test. And as the examination maneuver becomes more provocative, the test becomes more sensitive and less specific for carpal tunnel syndrome. In conclusion, there is no single test that can ensure the diagnosis, and value of tests varies in literature. However, the study reported that a combination of balance or Durkan'S test with a sensory evaluation is considered viable in practice, and the test will be considered positive if paresthesia or numbness is presented in the cutaneous distribution of the median nerve.